Hello everybody, welcome to the Thursday edition of Video Clips, number 3 in the series this week. One announcement, we are enrolling for summer semester at Wellness Forum Institute. And in addition to offering the Diet and Lifestyle Intervention course, which is a cornerstone course that our health professionals or health professionals in training take, we're offering nutrition and cancer, dietary intervention in employer and other group settings, and psychology too. So if you want some information about professional development courses, winters or summer semester at Wellness Forum Institute, careers in healthcare, send me an email at pampopper@msn.com. All right, I want to talk about feedback that I'm getting from people in the healthcare professions around the country. And I'll just tell you what some of them said. I think some of the emails that I'm getting are really telling. A medical transcriptionist writes this: in my work, I've not had any evidence of a pandemic until just yesterday, aside from one case in Corvallis, Oregon, a week or two ago. I've seen a lot of the empty hospital videos by all of the brave citizen journalists, and working on large hospital accounts spanning multiple states, the lack of work has been consistent with the videos. Today, I did about 5 reports on a South Carolina account by an infectious disease doctor, all of them COVID-19 cases. So a largely unbusy medical transcriptionist. No surge in Canada. This came from the National Post, April 11th, 2020. Some critical care physicians in the hardest hit provinces say they have yet to face that feared surge of coronavirus sufferers, kind of like what happened in Ohio. We figured out that in Ohio, for example, if all, one particular day when they were stocking the convention centers all over Ohio with hospital beds because of the coming surge, we figured out that if all of the people who had been hospitalized at that point in time had shown up on one day in Franklin County where I live, we could have put them in hospitals with rooms to spare, okay, if we just opened up the closed hospitals. So it makes you wonder about the convention centers being set up with hospital beds, just part of the insanity. So anyway, back to Canada, healthcare professionals report there are plenty of available ICU beds. In Ontario, 78% of the province's expanded ventilator capacity remained free. The patient volume was well under, quote, the best case scenario depicted in Ontario government epidemic modeling released earlier this month. In Quebec, 8 to 10 COVID-19 admissions a day to the ICU recently, none at all on April 7 and 8. Total ICU patients in the entire province, under 200, with 1,000 available beds. Doesn't sound like they're really anywhere near capacity there. It's my understanding that Canada remains largely locked down because this is so dangerous. We have to stop everything. In my center, we have still a lot of empty beds in the ICU, said a doctor late last week. This is a surprise. We changed all our schedules, our ICU schedules 3 weeks ago to be on call. We canceled all the teaching classes, all other administrative activities. So far today, I'm at home. It's not what we expected. Toronto's Sunnybrook Health Sciences Centre, which treated Canada's first known COVID-19 patient. No one is taking anything for granted, but the intensive care unit is definitely not overrun, said Dr. Gordon Rubenfeld, a critical care physician there. So apparently, lots of not activity in Canada. Here's another email. Our daughter is an OR nurse in a major hospital in Indianapolis. The surgery department has deep cleaned the entire department, and now they are literally doing nothing. Another nurse family member is in the same situation in her hospital too. Another email. I live on the Big Island of Hawaii, and we now have 12 active cases. No one required hospitalization and no one has died here. The population is close to 200,000 people. How does it make sense to close everything down and keep everyone at home and wreck the economy? It's beyond me. Here's somebody in North Carolina. I'm still working in the medical mill in North Carolina at a major hospital. I just wanted to also report that myself and coworkers are being sent home. I have not worked a full schedule in weeks. The way the hospital is reacting is so deplorable, in my opinion. I work in recovery, and I have CRNAs bringing people out from general anesthesia with oxygen in the patient's nose and a surgical mask on their face, just in case they cough. I've spoken with many nurse friends in the same position. I said when it started, if it was a pandemic, then pool your resources, isolate the vulnerable. You know, you're saying the same thing, talking to me. I even asked my hospital if I could volunteer and accept an assignment with a Samaritan Purse without pay, but I'm essential here. Really? Again, if this was real. I could go on. I feel like a lone voice in this mess. More unoccupied people working in the hospital. I'm from Oregon, and now our governor is working with California and Washington's governors, so who knows when the insane lockdown will end. A few blocks from my house, a tent was set up and stayed like that for a week. Empty. Then at dusk, a wall was built to enclose 90% of it. If you go down a certain way, you can see into it. Each time I have, the only people there were hospital staff. So all this building tents and putting beds in convention centers and this sort of thing. It just, I don't know. How do you explain it? Must be for show. That's all I've got to say. 360 healthcare workers in Akron were furloughed, Akron, Ohio, on April 14th. So while they're screaming about we don't know what to do with the people, we're going to be overrun, why are you sending all the healthcare workers home and building tents that are empty if this isn't, I mean, close up the tents, let's stop this nonsense already. This is ridiculous. I'll finish with some of the useless strategies used to address the ridiculous mess, and this comes from one of my folks here. I work at a grocery store as a cashier, and I do not know why we do what we do. Every hour, an employee of the manager's choosing goes to every checkout lane and wipes down the keypad, stylus, and the ledge you put your purse wallet on. I have done this procedure. I do not understand what good it does. First, none of us were trained on how to clean, sterilize these surfaces. One person uses one wipe for all the machines, over 25 of them, and the next person uses a separate wipe for each machine. I see the haphazard way that some employees clean the machines and actually skip some of the machines due to so many customers in that lane. I, because it's my duty to do so, wipe down the machines as thoroughly as possible. This only makes it somewhat clean for one person. If the person in line after it's clean coughs all over the keypad and has the flu, well, you can see my issue. It seems like it's all done for show. I have people thanking me for cleaning and I almost want to laugh. Also, our store closes early every evening instead of being open 24 hours as in the past. This seems contrary. We don't want to be close to people, yet we've shortened the hours our store is open, thus I would think making it more crowded. They claim shortened hours is to clean the store more thoroughly. However, again, it only takes one sick person to touch one item and then it's no longer clean. I'm all for keeping a store clean. I certainly do not want to feel grime when I use a handle to open a cooler or door. However, all this sanitizing seems ridiculous. Plus, I personally see people cleaning. I don't see them being thorough. If we have to sanitize, shouldn't there be training? Shouldn't there be standards? If not, it's useless, which I believe it is anyway. We also have plexiglass barriers up, which I understand would probably be good if ever there was a highly contagious disease sometime, but that is not now. Our employer also gives us the option to wear gloves and masks. Shouldn't this be mandatory if our health and the health of others is in such peril? I see customers wearing masks and gloves, many actually. I took a CNA course many years ago, so I think I understand the correct way to remove gloves and masks, and almost everybody I see cross-contaminates. I just want to scream, why wear the gloves or mask if you can't do it properly? I think these are useless and may do more harm because people aren't using normal common sense. They think they're immune to everything because a glove is on their hand. Never mind that they take their glove off, adjust their mask, or leave it on and dig in their purse. I want to scream. Now, the subject of masks. This is very interesting. I'm not wearing one. I refuse to. The CDC and many state health departments are instructing people to wear masks when going outside. The WHO says the opposite. And here I took this right off of their website. There is currently no evidence that wearing a mask, whether medical or other types, by healthy persons in the wider community setting, including universal community masking, can prevent them from infection with respiratory viruses, including COVID-19. WHO also said community masking could lead to, quote, a false sense of security and cause people to ignore other evidence-based measures like hand washing and self-isolation. Masks should be saved for healthcare workers, caretakers, and sick people. So, once again, insanity reigns supreme. And the question is, who are these people who are sitting in front of the television set and watching all this going on who aren't thinking something is seriously wrong? Empty hospitals, unemployed healthcare workers, people waiting. You can't get your teeth filled. That's an elective. Having an infected tooth that's in pain that causes you to not be able to eat anymore. We actually have members in this situation now. We can't do dental work here. Obviously, we're not licensed to do it, but the licensed people aren't allowed to do it either. So I guess if you can't eat anymore, that's just one more byproduct of clearing everything out, waiting for the surge that never happens. So that's what's going on from healthcare workers and people around the country reporting what's going on, and it is crazy. All right, thank you for watching. I'll be back to you tomorrow with some more news.